Hi, my name is Tracy Thomas. I own Sovereign Seniors. And today, in conjunction with your senior advocate, I am presenting this video about how to use the Medicare.gov system in order to shop around and enroll in drug plans for 2026 or any other subsequent year. Why do I know this? Well, I'm not affiliated with the government at all, but because my agency focuses on products that Medicare recipients receive, I know how to use this site to some degree. So I want to show you how to use this yourself. So I'm on the Medicare.gov page, and you can log in, or you will first need to create an account if in fact you haven't yet. So then you're going to log in. I'm going to use Valerie's site. And it's going to retrieve the current drug plan that you're on, and it's also going to populate with some of your drugs. So let me show you. I'm going to call this the landing page, which is where you're going to wind up. Up here, you can see right away, they know what plan you're on. So here, she's on the WellCare Value Script plan. Now, this is a long page with lots of sections, but we're only going to focus on two right now. I'm going to scroll down, and I want to focus on your pharmacy list and lower down your drug list. So for your pharmacy list, you can see I already have the Kroger pharmacy entered. But let's say I want to add another one. You click Edit My Pharmacies, add another one, and it's going to show you the pharmacies in your area. So let's say I want Walmart. Well, here's all of them really close to my zip code. I don't see Walmart in this first page, so I'm just going to type it in here. Find pharmacies. Now it's going to search for Walmarts in my area. Oh, boom. This is the one I want. You can see it's added to the bottom. You can add up to 5 pharmacies if you want to. When you're done, click in the lower right, Continue to View Plans. That's going to show you my new saved pharmacies, which is the Kroger and now the Walmart that I've added. And I click OK. Then you go back to the landing page, which is where we started. So we're going to scroll down. Now you can see your pharmacy list has 2 pharmacies. So now we're going to focus on your drug list. You see that there's 1 drug there. We want to add more. You can do it 2 different ways. You can click Add Recently Filled Drugs, and drugs that you've recently filled at the pharmacy are going to be listed here, and you can click on them and click Add Drugs. But for purposes of our training and to get kind of granular, I'm going to add each drug separately. So I'm going to click Edit My Drug List. This is where you will also, then you'll see your saved drugs, and you will click Add Another Drug. So let's add an insulin. So Lantus, and let's say I take 3 quick pens a month. So once I find Lantus, I have to enter the dosage, which is a pen injector. I have to list the package size, which I don't get 5 pens a month. So here I'll click 1 pen, and I will enter a quantity of 3 every month. And I will click Add My Drug List. Add to my drug list. Okay. Next one, let's add an inhaler. I take Ventolin, let's say. Watch what happens when I type in the brand Ventolin. I click Add Drug. You will get this message anytime you type a brand drug and there's a generic available. So I recommend you keep all your drugs right by you when you do this so that you know which kind you're entering, brand or generic. You also know the dosage and all the details. In this case, I can switch to the generic and enter that one, but I don't want to. I want to keep it brand. So that's what I will click here. Keep brand. It will pre-populate the dosage and the package. Let's say it's just a rescue inhaler. I use it like once a year. So I will actually type quantity 1 every 12 months. I can select any of these here. I don't recommend using every 2 months because the system, for some reason, will not do math correctly if that's what you select. But any of these others work. I'm going to select every 12 months. Let's add, for example, let's add levothyroxine. A lot of people take this drug. I want to use this drug as an example of the detail. Most people take a tablet form of this drug, but notice there are also a lot of capsules available. When you enter your drugs, be sure that you enter tablet or capsule correctly. It will greatly affect the math if you don't enter the right kind of drug. So in this case, I need to scroll all the way down to see my tablet options. And that's when I'm going to select my tablet quantity frequency and add it. And one more drug I'm going to add is metformin, another common drug. Note a lot of drugs are going to have blends with them. That's what you see at the top. If you don't, you're going to choose metformin hydrochloride. Click add drug. And in the dosage, this is where you're going to pick things like a regular tablet. Notice here they also list extended release or delayed release. They also list osmotic. So you just want to be very careful how you fill this out. Again, looking at your bottles. And for purposes of this, we're just going to select the 500 milligram tablet. Let's say I get this filled every 3 months and I just do a pill a day. So I'm going to say I fill 90 at a time and I fill it every 3 months. And I click add to my drug list. Here is my list of saved drugs. When I'm done, I click done adding drugs at the bottom. It takes me back to the landing page. So we've got our pharmacies and our drugs updated. Now you will click on this button in the middle, Find Plans Now. Your year will be defaulted, your zip code as well. Hit continue and select Medicare Drug Plan Part D and Find Plans. What it's going to pull up now is all the plans available to you next year, and your plan will be listed at the top. So here's your plan next year, and here are the metrics associated with it. Premium, how much your drugs are going to cost, deductible. I want to compare it. So this number here is about $1,000. Now let's look at some of the other plans. Oh, well, look here. This plan, it's only $308. So let's say I want to add that to my thinking. You'll click add to compare and notice that plan gets added to the bottom. You can add up to a total of 3 plans to compare. So just say I want another carrier. We'll add this to compare. Now we have 3. We will click the compare button in the lower right-hand corner. Now it's going to pull up for you the 3 plans from a high level. So you can look at some of the things like deductibles, premiums. This is what I want you to really focus on besides that. Notice that the drugs covered, 4 out of 5 are covered on WellCare. 4 out of 5 are covered on SilverScript. Well, I kind of want a plan that covers all my drugs. So let's just say I'm going to look at the Humana Value Plan. Now when I want to see more specifics, I click Plan Details. Now you're going to get into the deep dive of the plan. Again, this is a long page to scroll through. I'm going to focus on a couple key areas. Here's the area where you entered your drug so you can confirm it. I want you to see here, of the 2 pharmacies I entered, both are in network, but one is preferred. Preferred pharmacies will have the cheaper price, so it's ideal to have a preferred pharmacy on your plan. Here's a breakdown of the cost of the drugs for the whole year. And this is what I really like to look at. This is an estimated total cost of your drugs for the year plus your premium for the year. So you can see here that Kroger's 346, Walmart's 308 might be in my best interest to fill my drugs at Walmart next year for that little bit of extra savings. It will also break down your drug costs by month. If you keep scrolling, you can click on these pharmacies here to actually get a breakdown of the cost of each drug each month at each pharmacy, which we're not going to do right now, but you can click on it. It's a wealth of information here. I do recommend clicking this here, view more drug coverage, that you'll see at the bottom, because there's 3 sections I want you to pay attention to here. There's prior authorization, quantity limits, and step therapy. What are these? Well, here's your drugs listed on the left-hand side. You can see the tier that they're affiliated with here. Prior authorization, if you see a yes here, it means that your doctor is going to have to call the drug plan and approve your drug before the drug plan will cover it. It's not a knockout thing, but just you need to be aware of that. Quantity limits. This is some plans and some drugs, just they don't cover as many pills as you need sometimes. Sildenafil, headache pills, pain medicine. Those are some very common ones where you only get a limited number a month. If you have a quantity limit, it will say yes, and you will want to click on that to understand if the plan will cover the quantity you need each month. Step therapy is when a plan is going to require you to take another drug first before you fill your actual drug, because the plan wants you to take that step first. So these are all things to be aware of before you enroll in the plan. Okay, so let's say we go through this. I'm scrolling to the top, and you like the plan. You want to enroll in it. Starting October 15th, there will be an Enroll Now button near the top. You can't do this until October 15th, and you have through December 7th. So during this time, you can go and you can click the Enroll button. It will take you through the enrollment process. A couple things to know. At the end, you'll get a confirmation number that you enrolled. Write that down just so you have a reference number. 2, if you change plans, at the end of the year, your old plan will cancel and your new plan will go into effect, and you don't need to do anything. That is all done behind the scenes. 3, if you want to go back into this program and try it again or shop again, and let's say you pick another plan during this open enrollment period, the last application you do will be the plan you're going to enroll in. Okay, I think that's it. I made it under the time limit. Hopefully this will give you a nice overview, and by all means, you can definitely give us a call if you need to have any additional instruction or help. Good luck in finding your plan. Have a good day.